Today we will discuss about the osteology of hip bone. In first part we only cover the external features, and the second part we will cover the muscle attachment of hip bone.
The hip bone is also known as innominate bone and it is irregular in shape. It consists of three bones: ilium, ischium and pubis. Ilium, ischium and pubis, all three bones are joined together at the acetabulum, a cup-shaped hollow concavity. It is going to form a ball and socket joint where there is a triradiate cartilage present initially, and later on, because of the ossification, the cartilage replaced by the bone from secondary ossification. So when you hold the hip bone in anatomical position, you will realize that the ilium is superiorly, the pubis is antero-inferiorly, and the ischium is postero-inferiorly. The ilium contribute 2/5 to make acetabulum, the ischium also 2/5 and the pubis 1/5. So the hip bone is not a single bone. The prepubic part of two hip bone joined anteriorly to form the pubic symphysis, a secondary cartilaginous joint. The two hip bone together form the pelvic girdle. Now we talk about the side determination of hip bone. So the middle part is always constructed part. The upper and lower part is expanded. The middle part exhibit deep cup-shaped acetabulum, the space laterally, and lower expanded part exhibit obturator foramen. सो जब हम इसको एनाटॉमिकल पोजीशन में होल्ड करेंगे तो हम देखेंगे कि जो एसिटाबुलम है वो हमेशा लेटरली ही प्रेजेंट होगा, क्योंकि ये फीमर के हेड से आर्टिकुलेट करेगा, तो ये जो बोन है वो लेफ्ट साइड की बोन होगी. व्हेन वी होल्ड इट इन एनाटॉमिकल पोजीशन वी रियलाइज दैट pubic tubercle and the anterior superior iliac spine lies in the same coronal plane. The symphysial surface of pubis lies anteriorly in the median plane. The upper border of pubic symphysis and the ischial spine lies in same horizontal place. So now we talk about the first part of hip bone, ilium. Ilium forms the upper superior part of hip bone, an expanded area. It is a plate-like structure. Now you can see plate-like structure. It has two parts, upper end and the lower end. This one is upper end and this one is the lower end. Lower end forms the upper 2/5 of the acetabulum. Okay. The lower end of ilium forms 2/5 of the acetabulum. It has three borders and three surfaces. Three borders: anterior, posterior and medial. Now we talk about the first border, anterior border. Anterior border, it extends from anterior superior iliac spine to the acetabulum. ये ilium, iliac crest, इसका end anterior superior iliac spine to acetabulum. The anterior border has two parts, upper part and the lower part. The upper part present a notch and the lower part present an elevated area. This one is elevated area. It is called anterior inferior iliac spine. Okay, this is the anterior border. Now we talk about the posterior border. The posterior border extends from posterior superior iliac spine to the upper half of lower margin of greater sciatic notch. This one is greater sciatic notch. Now you can see this is the iliac crest and this is the posterior end and anterior end. Posterior end is called posterior superior iliac spine. So posterior border extends from posterior superior iliac spine to the upper half of lower margin of greater sciatic notch. There is present in another prominent called posterior superior iliac spine. Okay. Now we talk about the medial border of ilium. The medial border extends from iliac crest to the iliopubic eminence of This is the medial border. It separates two surface, iliac fossa and sacropelvic surface. This is the surface of ilium. So medial border divide two surface, iliac fossa and the sacropelvic surface. Now we talk about the surface of ilium. It has three surfaces: gluteal surface, iliac fossa and sacropelvic surface. So the outer surface is the gluteal surface. Okay, this one is iliac fossa, and third is sacropelvic surface. So we talk about the first border, gluteal surface. So the gluteal surface is the outer surface of hip bone and it is concave behind. You can see concave behind and convex front. Okay, this surface divided into four area by three gluteal line: anterior gluteal line, medial gluteal line, posterior and inferior gluteal line. So now we talk about the first gluteal line, anterior gluteal line. So the first gluteal line, anterior gluteal line, it extends from 4 cm behind anterior superior iliac spine. This one 4 cm behind anterior superior iliac spine to the upper border of greater sciatic notch. This one anterior gluteal line, medial gluteal line and the posterior gluteal line. So anterior gluteal line will be longest and the posterior gluteal line 5 cm front from posterior superior iliac spine to the upper end of greater sciatic notch. Okay, posterior gluteal line, anterior gluteal line and medial gluteal line. These three lines divide the gluteal surface into four areas. Now we talk about the iliac fossa. Iliac fossa is inner surface. It is largest and concave area. It forms the lateral wall of false pelvis. Now we talk about the third, sacropelvic surface. It is inner surface, uneven area. It is situated behind its medial border. This one is medial border and this one is sacropelvic surface. So it is situated behind its medial border. It is divided into three parts: iliac tuberosity, auricular area and the third one pelvic surface. So the sacropelvic surface divided into three parts: iliac tuberosity, auricular surface and the pelvic surface. Now we talk about the first part, iliac tuberosity. It is upper large roughened area just below the dorsal segment of iliac crest. Okay, this one is iliac crest and now this one is iliac tuberosity. It is for interosseous sacroligament. The third one is sacropelvic surface. Sacropelvic surface is inner surface, uneven area situated behind its medial border. This one is medial border and this one is sacropelvic surface. Okay, so the sacropelvic surface divided into three parts: iliac tuberosity. This one is iliac tuberosity, this one is auricular area and third one is pelvic surface. Now first one, iliac tuberosity. It is upper part, large and roughened area just below the dorsal segment of iliac crest. This is the ventral segment, this is dorsal segment and behind this iliac tuberosity. It is for the interosseous sacroiliac ligament. Okay, auricular surface, articular but pitted, lies antero-inferiorly to the iliac tuberosity for sacroiliac joint. Now this pelvic surface, it is smooth and antero-inferior to the auricular surface, forms the upper part of lateral wall of true pelvis for origin of obturator internus. It has pre-auricular sulcus which is more prominent in female. Now we talk about the iliac crest of ilium. It is concave anteriorly and convex inward posteriorly. It has two ends, anterior end and the posterior end. Anterior end and the posterior end. Anterior end called anterior superior iliac spine and the posterior end called posterior superior iliac spine. The crest divided into two parts, the ventral part and the dorsal part. Okay, the ventral part further divided into three parts: outer lip, inner lip and the intermediate area. Okay, now dorsal segment divided into two parts: inner lip and the outer slope, inner slope and the outer slope. Now there is an important point, tubercle of iliac crest. On outer lip of ventral segment 5 cm behind the anterior superior iliac spine, this one 5 cm from anterior superior iliac spine, and lateral of sacral spine has 2. There is a present an elevation called the tubercle of iliac crest. Okay, the iliac crest lies at the level of interval between the L3 and L4. So now we talk about the second part of the hip bone, ischium. Ischium forms the posterior inferior part of hip bone adjoining 2/5 of the acetabulum. It forms the posterior boundary of obturator foramen. This one is obturator foramen, and the ischium forms the posterior boundary of the obturator foramen. Ischium has two parts, the body and the single ramus. Okay, the body lies just below and beneath to the acetabulum. The body has thick and massive mass of bone. It has two parts, the upper end and the lower end. Three borders, anterior border, posterior border and the lateral border. So this one is the anterior border, the posterior border and the lateral border. Okay, three surfaces, the femoral surface, the pelvic surface and the dorsal surface. The upper end of ischium of body forms the posterior inferior 2/5 of the acetabulum. Okay, and the lower end form the ischial tuberosity. You can see the ischial tuberosity. Lower end of body forms the ischial tuberosity, and ramus of it forms an arcuate angle with the body. The anterior border of ischium forms the posterior margin of obturator foramen, and we talk about the posterior border. Continue about with the posterior border of ilium. You can see this is the greater sciatic notch, this is the later sciatic notch, and this is the ischial spine. So below greater sciatic notch, posterior margin show a projection. It is called the ischial spine. Below spine, posterior border show a concavity called the lesser sciatic notch. Okay, so the posterior border of ilium continue with the posterior border of ischium. The lateral border forms the lateral margin of ischial tuberosity, except it's the upper end because it is slope area. So now we talk about the surface of ischium. This is the femoral surface of ischium. It lies between the anterior border and the lateral border of ischium. This is the femoral surface. And the pelvic surface between the anterior border and the posterior border of ischium. So the surface of ischium, it has three surfaces: femoral surface, pelvic surface and the dorsal surface. The first one is femoral surface. It lies between the anterior border and lateral border of ischium. This is the femoral surface. Second one is dorsal surface. Dorsal surface continue above with the gluteal surface of ilium. It presents a ischial tuberosity. So the ischial tuberosity is divided into two parts, upper area and lower area, by a transverse ridge. The upper area is further subdivided into two parts, the superolateral and the infero-medial area, by an oblique ridge. And now lower area is further divided into two parts by a longitudinal ridge. So the pelvic surface lies between the anterior border and the posterior border. It forms the lateral wall of true pelvis. Now let's learn about the ischiopubic rami. The inferior ramus of pubis joined with the single ramus of ischium medial to the obturator foramen to form the conjoined ischiopubic rami. It has an upper border and a lower border and two surfaces, the outer surface and the inner surface. So the upper border forms the part of the margin of the foramen, and the lower border forms the part of the pubic arch. The inner surface is smooth and convex and further divided into upper, middle and lower part by two ridges. The upper surface is rough because of the attachment of the muscles. So the next part of hip bone is pubis. The antero-inferior part of hip bone is pubis. It forms the anterior 1/5 of the acetabulum and forms the anterior boundary of the obturator foramen. It has three parts: the body, the superior ramus and the inferior ramus. Now we talk about the first part, body. Now let's learn about the body of the pubis. The superior border is called the pubic crest. At its lateral end there is a tubercle called the pubic tubercle. The body of the pubis has three surfaces: anterior surface, posterior surface and the medial surface. So this one is the anterior surface, downward and laterally. This is the posterior surface, smooth, directed upward and backward, forms anterior wall of the true pelvis. The next one is symphysial or medial surface. It articulates with the opposite pubis to form the pubic symphysis. Now we talk about the superior ramus. It lies between the body of pubis to the acetabulum, located above the obturator foramen. It has three borders and three surfaces. It has three borders and three surfaces. Superior ramus has three borders and three surfaces. The superior surface, the superior border, the anterior border and the inferior border. Again, the superior border, the anterior border and the inferior border, this one. Okay, three surface: pectineal surface, the obturator surface, this one, and the pelvic surface. The first one is the pectineal line or the superior border. It also called pectine pubis. It is a sharp crest extending from behind the pubic tubercle to posterior part of iliopubic eminence. Next, the anterior border, also called obturator crest. It extending from the pubic tubercle to the acetabular notch. The inferior border is sharp and forms the upper margin of obturator foramen. The pectineal surface is an triangular area between the superior border and the anterior border. It extends from the pubic tubercle to the iliopubic eminence, this one. The pelvic surface lies between the superior border and the inferior border. It is inner side and it is smooth, continue with the pelvic surface of pubis. The obturator surface lies between the obturator crest and the inferior border. It presents the obturator groove. Now look at the inferior ramus. It extends from the body of the pubis to the ramus of ischium, medial to the obturator foramen. It unites with the ramus of ischium to form the conjoined ischiopubic rami. Now in the next part, second part, we will learn about the muscle attachment of hip bone. Thank you.